So there's an
Mm.
awful lot that people can do before they get pregnant. And I think sort of preconception care, that time period for both the man and the woman, is really important. I mean, in some ways, it's really very personalized care, making sure that you're fit for pregnancy. So people go, men as well? I'm like, yes. So we know that if you are a man and you're thinking about having a baby, if you're overweight, your partner may be more likely to have a complicated pregnancy. So men, stop smoking, reduce your alcohol intake, stop your alcohol intake. That will improve your sperm count, very likely. Get fit. Women, get fit, stop smoking, reduce their alcohol intake, eat a diet rich in sort of a Mediterranean type diet, so lots of fruit and fresh vegetables, oily fish, that kind of thing. Take your folic acid. So taking folic acid, 4 micrograms every day over the counter, reduces the risk of the baby having spina bifida. So very important, getting fit for full pregnancy. So that's a real self-personalized thing that you can do. I think other personalized risk is, for example, with medical conditions, if you have diabetes, if you have epilepsy, if you have thyroid problems, you can now get referred to what's called the maternal medicine network. So it's clear that if you have a maternal medical condition, then if that's optimized before you get pregnant and early pregnancy, then you will have a better outcome. Things like diabetes, if you have diabetes, getting your sugar control really nicely stable will reduce the chance of the baby, of you getting diabetes problem complications later in pregnancy, like, for example, having a really big baby. Also thyroid problems as well, optimizing, making sure your thyroid levels are good, and epilepsy, making sure you're on the right medication. So there are now ways that you can get personalized care, and you can get a referral from your GP to the maternal medicine network, where people who are experts in maternal medicine, so these are obstetricians or physicians who know all about how to improve the outcome for your pregnancy. And then that also means that you can really improve outcomes, reduce the risk of things like preeclampsia, where people get high blood pressure in pregnancy, reduce the risk of preterm birth, reduce the risk of having a small baby. So I think that's why we need to get this message out that actually there are lots of things that people can do, but it's really difficult to get that message out because, how do we do that? We have to probably put it on the side of buses